Medical professionals in American culture lovingly embraced the disease concept and quickly applied it to every possible deviant behavior, from alcohol abuse to compulsive lecturing. The disease concept was a panacea for many failing medical institutions, adding billions of dollars to the industry and leading to a prompt evolution of pop psychology. Research has shown that alcoholism is a choice, not a disease, and stripping alcohol abusers of their choice by applying the disease concept is a threat to the health of the individual. What do you think about them apples?
Well, I disagree with those apples. I think that people that are alcoholic have a system that says go, 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 go.
Yes.
I have a system where I have a couple of drinks. It says stop, stop, stop. Or it says we're just not interested anymore. You put a bag of potato chips in front of me, and then that's a different story. I've got a whole other demon to fight. But potato chips and alcohol, maybe not the best comparison. Alcohol, with some people, just takes over. They can't. It's poison for the system. They can't have it in their system. It's poison.
Here's the thing, though. Let me just be the devil's advocate here. If you get, if you're in that place, and you have an intervention, which as I'm sure many people have seen the show Intervention.
I haven't.
And well, it's kind of interesting. It is interesting, and there are people in the psychology field that are intervention specialists alone.
Yeah.
That's all they do. They don't do psychological, they don't do therapy. They just go in and do interventions with families. And they prepare what I see as the enablers who basically facilitate the disease. They if you take the disease model, they give the money to the addicts, they give them homes, they let them come and go, and they wreak havoc, and they permit it, and they don't set boundaries in order to facilitate, recovery.
Yeah.
So they're encapsulated in the illness themselves.
Yes.
Do you use disease? Do you say illness? I see it as an illness.
What's the difference?
It's interesting because it starts to go down to language, because the sense with disease on some level maybe is that it's untreatable, that eventually it will kill you.
Oh, it's a treatable disease. You have to stop drinking.
Right.
That's the cure.
Right. How is it, though?
Yeah.
Because I've seen this on Intervention.
Yeah.
You get enough family members who say, I am no longer going to enable you. I understand that I've contributed, and I have my own illness. I understand that I'm not giving you $20 anymore every time you ask me for it, or you give me some pitiful story about how you can't do this or that, or you know where to sleep tonight. I am going to say to you, you're going to have to sleep at the bus shelter.
Right.
And when you get to that, and then you say, but I will say, go to treatment today, and you have my full support.
Yeah.
With enough pressure from enough family members and enough friends, many times that alcoholic or that drug addict or that gambling addict has said, okay, I'll go. I'll do it.
Yeah.
So what is that moment of choice where pushed up against a wall,
the choice
the
is
addict
there.
will say...
I think the choice is there all along. I think the choice is all along. It's like
I'm a bit confused then.
Well, anything that you want to give up. Well, tell me where you're confused first.
Well, I thought you said it wasn't a choice.
I said there's not a choice that you get the disease when you drink. There's a choice that you can stop drinking. You have to recognize you have a disease. That's the point I'm coming from. You have to recognize I have a disease. The cure for my disease is that I cannot drink anymore.
All right. So I go online, I access internet porn.
Yeah.
I'm pulled in.
Yep.
I'm obsessed by this.
Yeah.
And from what I'm hearing you say, is like a daimonic,
yes.
and it sucks me in, and it's got me in a grip,
That's
and
right.
boom, I didn't even know it had happened to me.
That's
Is
right.
that what you're saying?
That's what I'm saying.
Okay. What?
Thought she was going to hit me there for a second. I don't know why. You're so impassioned. I thought anything could happen.
Well, it could have been good.
It could have been good too. You're right. I don't know why.
Childhood history.
That's my problem.
It was feeling good to me.
Oh, it was. It was.
Yes.
It's interesting.
I just if I sort of live it, then I can feel, can experience it, and that gives me more clarity.
I think maybe we're just sitting too close, is what it is.
I did tell you to sit back
It's a small table.
So okay, well that's an interesting perspective though, is that it's almost like somebody's thrown a great big hook around your neck and yanked you in,
Yeah.
and you didn't even see it coming.
You didn't ask for it. You just want to have a drink every once in a while and be able to stop like normal people. You just want to be able to look at a little porn every once in a while and be like normal people, if you want to call it that. But I didn't want to spend 8 hours a day at this. I didn't want to walk away and then ignore my children and ignore my wife because I have to go sneak into the room and watch it for another 8 hours.
Okay. Here I am being the devil's advocate again. How are we for time? We're supposed to. We'll take a break in a minute.
Well, we got in 3 minutes, right?
Okay.
Halfway point.
Okay.
All right.
What? so what if that's not the case? What if the hook comes around me, and I'm pulled into an internet porn site?
Yeah.
And there's a small, tiny voice in me that says, I'm pulled in, I'm in here, I don't know how I got in here.
Mm-hmm.
I don't really want to be in here.
Mm-hmm.
But 99% of me says I do. What about the 1%?
What if it's 51-50? All you need is that 1% to be in the.
Oh no! Okay. So I want to know about the 50% that's talking to you still.
Yeah.
But the 51% that's going along with the daimonic, to quote Steve Diamond.
Yeah.
Okay. Then it doesn't support your theory that says it's not a choice. If you have 50% functioning for you.
No, 51-50 is bad because that's 101%.
That's also when the pet team comes, when you call in a 51-50.
Right. The question was.
When you are out of control.
The question was that if there's a voice. And the voice my answer to that is
there a voice?
There is a voice. Yes, of course. Just because you're addicted to something or you're alcoholic doesn't mean that there's not another voice that's going, I know this isn't okay. But then the other voice says, but it's okay this time. Just this time. Just one more time. You deserve it. You've worked hard. Look at you. What, do you expect yourself to be perfect? Nobody's perfect. Look around. Everybody's got a problem.
But I'd rather go with that voice. I'd rather go.
Well, you'd rather go, but
not with the Jiminy Cricket voice, but with the daimonic that's much more seductive and is going to not require me to be responsible for the pain that I don't want to look at.
And if that side continues to win, time after time, and your life keeps going backwards and becomes unmanageable, you have a disease because it wants to kill you. It wants to take over your life. It wants to wreck your life.
And does it? And it's going to wreck your family. And if you have children, it's going to wreck your children.
I wouldn't say the big picture. I would say it's a smaller picture of consciousness. That it's bad. That it's.
I don't think it's a smaller. No, I don't think it's a smaller consciousness. No, I think it's pretty big.
But my point is that it's. I don't think you think in the way that I know I'm going to lose this. I know I'm going to lose this. It's that. I think it's. I know what I'm doing is wrong. I know it's taking away, but I'll stop tomorrow. I'll watch half as much tomorrow. I'll drink half as much. I'll just have 2 beers and I'll come home. And you tell yourself that thing over and over again, and then one day you wake up and you find out that there's this wreckage around you.
Yes. Okay. Well, yeah. No, I absolutely hear what you're saying. I do.
All right.
And I want to add to that and talk about it some more. So we'll just take a little
break.
Yes.
All right.
And we'll be right back.